Sample collection. Collecting the sample is the first step for all types of tests in the laboratories. Different types of samples are taken from the patients through different routes. For example, for whole blood sample, we may perform venipuncture with SOPs from inside of elbow using median cubital, cephalic or basilic vein. Or we may take it from backside of hand using butterfly needle, usually if we could not find a prominent vein in the both arms of a patient. The taken blood is centrifuged sometimes because many tests require plasma. For sputum sample, we ask the patient to cough powerfully after taking a deep breath and then collect the sputum in a container. For urine analysis, patient is asked to urinate in the container, avoiding from filling the urine drops or sprinkles elsewhere. For fluids and tissue specimens, we may perform biopsy and aspiration under specific protocols. The second step is transferring of samples. The most commonly specimen used for hematology or biochemistry testing is whole blood, serum or plasma. So there are different sort of collection tubes for this purpose. Like first of all we have EDTA purple top tube which contains an anticoagulant EDTA which stands for ethyl diamine tetraacid acid with K2 or K3. It is used for CBC, HbA1c, CRP or other blood tests, etc. Then we have lithium heparin green top tube. It is having lithium heparin which helps to prevent from blood clotting. Its centrifugation is usually done to get heparinized plasma which can be used for electrolytes, LFTs, RFTs and other routine chemistry tests. Then we have sodium citrate tube also known as blue top tube which is used for coagulation profiles and have an anticoagulant sodium citrate in it. Then yellow top tube which contains acid citrate dextrose, an anticoagulant and used for special tests. Then blood culture tubes responsible for microbiological testing and blood is drawn into it first of all after performing venipuncture to avoid from contamination. Then there are many other collection tubes also which are made for specific tests like grey top tube which contains sodium fluoride and used for glucose testing, red top tube used for collecting clotted blood or serum specimens. Same-wise, other samples like sputum, urine, tissue fluid, etc. are transferred to the labs with proper care and responsibility for the purpose of testing. Following of SOPs is mandatory with each single step in the labs while performing phlebotomies, and identification of patient with his sample must be done carefully in order to avoid from any kind of wrong or misidentified results. At last, we have processing and analyzing of the samples. After sample is collected and transferred to the lab, it is used to be processed and analyzed under the supervision of technicians, technologists, and lab manager, etc. The specific test is done then accordingly. For example, with whole blood sample, we may perform CBC, HbA1c, CRP or other blood tests, etc. With sputum sample, we may have its culture. With urine analysis may be done and so on. Then after the processing of different type of tests, their analysis is done and these are reported for the further purposes. That's how the sample collection, transferring, processing and analysis is done in the medical laboratories.